What we try to do at the Robert Wood Johnson Foundation is help make change through the investments that we make in people. We're looking for someone, a physician, a dentist, a nurse, a lawyer, a political scientist, who we think has the potential to be a change agent in health and healthcare. It goes back to our mission, improving the health and healthcare of all Americans. With the people that we've been investing in, we can move ourselves closer to that.
I'm a pediatrician. I chose to be a clinical scholar because there clearly were issues that impacted children's health that were beyond the scope of traditional medical training. The vision from the foundation early on was that physicians can be multi-talented and can, as human beings, provide service, not just in the examination room. As a clinical scholar, I started working with the city. Now, I'm Deputy Mayor for Health and Opportunity and the Health Commissioner of the City of Philadelphia.
I'm a first year in the Clinical Scholars Program. My support comes from the VA, so I'm doing my clinical time at the Philadelphia VA Medical Center. There's these problems that I keep hearing about from my patients. I want to solve them for Mrs. Jones, but I also want to figure this out on a deeper level and do something about it systemically. I wanted to create a community health worker-based patient navigation program to reach marginalized groups of people.
All of us have a very strong commitment to making sure that we're not just generating knowledge for knowledge's sake, but we have something that can be practically applied and help people in real time.
But whenever you're taking the lead on solving a problem, you're inevitably in uncharted territory. This is literally old school apprenticeship mentoring where they completely have your back and are with you every step of the way.
They have to be certified.
I'm an epidemiologist. Before getting interested in health policy, I crunched numbers. And I was always interested in how those numbers were used. The Health Policy Fellowship changed my life. It shows you how complex the interactions are that go into political change. I learned strategically how to move a proposal forward. And that's what one does as a Hill Fellow, and that's certainly what one has to do on a regular basis as a senior administration official. Now, I run OSHA. We're responsible for the safety and health of 130 or so million workers around the country.
Last September, I started the Robert Wood Johnson Health Policy Fellowship, moved here with my family. It opens up some opportunities that there's just no other way I would have gotten. Starts off with an orientation and gives us an introduction to pretty much anybody in DC who touches health policy at the federal level. Sort of electronic Rolodex. Government and policymakers have to make all these decisions, and they don't necessarily understand how the research fits into it, how the actual healthcare delivery systems work. I'm on Senate Finance, where a lot of the action happened in healthcare reform. I'm the only physician on the committee. That means a lot.
I started out, like every nurse, on a typical med-surg floor working as a charge nurse. Now, I'm Vice Chancellor at North Carolina Agricultural and Technical State University. Nurses have the skills, the caring and concern to make a difference much broader than just within a hospital setting. One obstacle for nurses moving up in leadership positions is there is not adequate coaching and mentoring early on in your career. In the program, we were encouraged to find mentors who were outside of healthcare even. I never thought that I could be a president of a university or of a hospital system, which is what the Robert Wood Johnson Foundation made us all believe, that you just don't stop at what you feel comfortable with, but you have to stretch yourself so that you break that ceiling. This is the 1999 cohort for the Robert Wood Johnson Executive Nurse Fellows Program. This is me.
I'm part of the 2011 cohort Executive Nurse Fellows. Clearly, all the people that are in the fellowship are already leaders. All of us have gotten there some kind of way, but this pushes us up to the next level. This has been the National Organization of Nurse Practitioner Faculties. I'm actually president-elect and will be president starting in April. I teach at the University of North Carolina at Chapel Hill. I had aspirations to become a dean someday. They said, well, you know, you may need to stretch a little higher. And I believe I will.
The people that we've been investing in, our scholars, fellows, and leaders have an opportunity to make significant change and have a significant effect on the systems within which they work. To be the change agents.
So if that's your goal, what you have to do is figure out a way that you can influence that system and the people in multiple ways.
People who can contribute ideas and have a sense about what the direction should be.
To make sure we have a healthier, stronger country. It's fascinating, it's thrilling, it's humbling, it's a wonderful experience.